Good evening, this is BNN News. I'm Chris Lovett. Our top story, a switch from a lifeline for Boston's homeless. A city council hearing took place yesterday on plans to close two separate transitional programs serving 40 people in recovery. City officials say they plan to continue services and help with housing, but program residents say they need more stability.
We had a stable place with a bed dealt with our substance abuse, medical issues, and housing issues. And now we've lost that. And now we're back to where we started from before we got to the program.
It's almost impossible to have people succeed without being able to have built a foundation in recovery with like-minded people. When I moved on, I had a foundation. I had people to support me, but it's very hard to build that in a shelter situation because there's no one recovering there.
The consensus is housing first and then treatment, and that is counterproductive because how can you house someone that is not stable or is in the process of being stabilized mentally, physically, spiritually, in all areas that you could think of?
And I don't think that it's a viable option to replace transitional housing at all, because it's not. For somebody, say I make minimum wage. The rent is, let's say, $1,500. Yeah, they help me get in there, but how am I going to continue to pay that? Say if I have a little money saved up, I make it a few months, I'm done, I'm back into the system.
We were here not that long ago on Long Island. And so to hear again that the Boston Public Health Commission has created an artificial crisis for the most vulnerable people in the city of Boston really questions whether or not we are living up to the mission that ends with protecting the most vulnerable people among us.
I think this new way of providing services is one of the best, because what it does is it's giving a lot of resources to get people out of shelter as quickly as possible. And the worst thing that can happen is people come in shelter and they get comfortable. So we're really trying to be able to help people move out as quickly as possible and be successful.
This news about the programmatic changes, I understand it's upsetting to our clients. This is something that we've had to do to adapt to a new federal policy around rapid rehousing. So we'll continue to work with each of our clients to make sure that they're connected to permanent housing, supportive housing, and that we continue to provide them with linkages to referrals to treatment and services.